Hello world. I'd like to make you think. This is inspired by the current COVID-19 pandemic and consequent orders of lockdown, shelter in place, quarantine, and so on that affect about half the world's population. First, a few facts I've gleaned from the World Health Organization, the U.S. Center for Disease Control, and several other sources. The virus is called SARS-CoV-2, but I'll abbreviate it as SARS-2. How deadly is SARS-2? Scientists call this the case fatality rate, or CFR. It is about 3% points more deadly than seasonal flu and measles, but several points less than SARS and tens of percentile points less than smallpox, measles, bird flu, and Ebola. In other words, its CFR is really pretty low. This ranks it at about 45 on the Wikipedia CFR list of about 62 diseases. Please note that I am not referring to all types of flu when I say seasonal flu. Some, like bird flu, are far more virulent than SARS-2. In terms of how easily transmitted SARS-2 is, it is low on the list, too. Scientists call the rating of how communicable a disease is R0, with 0 being none. It is a measure of how many people are likely to be infected by the average infected person. It is 1 to 2 more communicable than the MERS, Ebola, and seasonal flu, but barely less communicable than SARS, and 2 to 12 points less than smallpox, mumps, rubella, and measles. In other words, it has an R0 of about 2 to 3. The common cold has a rating of almost 0, while smallpox has a CFR of 30%. This means that SARS has a very low R0 or on R0 also. Who is most at risk of death? While anyone can get it, those with chronic illnesses like diabetes, heart disease, and lung disease, those who smoke, those who are obese, those whose immune systems are compromised or weak, and the elderly are most at risk. This is fairly similar to the current seasonal flu in some respects, which has a higher CFR and a lower R0, but is very different from the Spanish flu during World War I, more properly known as H1N1 1918. The H1N1 1918 flu came in 3 waves over 3 years, from 1918 to 1920, with the second wave being the most virulent. Mr. Anthony Fauci, the leading U.S. doctor on infectious diseases, suggests that there is a good chance of a second wave of SARS-2. Will it be worse? There's no way to know. He also suggests that warmer, more humid weather will slow down SARS-2. Why do we need to do all this lockdown stuff? It's not for the average person. It's more to prevent healthcare systems globally from being totally overwhelmed, as well as causing the loss of lots of doctors and nurses and the death of non-COVID-19 patients who can't get the resources and help they need because the system is flooded with patients. In other words, we're protecting the healthcare people who are having trouble getting basic personal protective equipment, or PPEs, like gloves, masks, and sanitizers. And we're reducing the number of deaths that will be indirectly caused by COVID-19. We may also save the lives of some people who would otherwise succumb to it. Over the past couple of months, billions of people have been manipulated by the media into reacting hysterically. It's not hard to do, really, and most media outlets focus on sensationalistic instead of factual, neutral reporting in order to increase sales. When the lockdowns first started, people were hoarding staple foods and toilet paper worldwide. Where I live, it's mostly just toilet paper and other tissues now, although grocery stores have had to put limits on customers to prevent them from hoarding. In many places, school systems have been shut down, as have non-essential businesses, which often include daycare centers. To be fair, aside from medical centers and clinics, daycare and schools are high-risk transmission sites for diseases. Millions and millions of people are unemployed. Many people in this category were already living hand to mouth and without a way to secure money will eventually starve, turn to crime, or riot unless governments take affirmative action to save them. Some countries already have failed healthcare systems while others are failing. Some countries also cannot provide help to their poorest citizens. In fact, yesterday, April 2nd, the presentation by the World Health Organization, the leader asked the worldwide community to provide different kinds of support to countries that are in trouble because they don't have the resources to help their citizens. Even with the current measures, SARS-2 will spread to a majority of humans over time and may become a seasonal illness, according to Mr. Fauci. People who are infected can transmit the disease by about the second day, even if they have no symptoms, and can be pre-symptomatic for up to 14 days, which is to say they don't have symptoms but will. And some people never show symptoms, which is asymptomatic. Some studies are showing that large numbers of people can be asymptomatic. As of April 3rd, 2020, the total number of confirmed cases is 1,026,974, which is only about 0.01% of the world's population. And the total number of deaths is 53,975, which is only 0.0007% of the world's population. Finally, it is absolutely certain that the number of SARS cases and COVID-19 deaths is lower than the reality, although experts cannot say how high the real numbers are. Some countries do not have the resources to do testing on even a limited basis, and most only test those who are exhibiting enough symptoms because of limited testing supplies and other problems. This is true even in the U.S. Only recently has China started testing non-symptomatic patients and discovering the high rate of COVID-19 carriers, or more appropriately, SARS-2 carriers. So think about all those facts. Those are just a few of many facts that can easily be discovered by anyone who takes the time to properly research, which means that you have to be analytical and objective. So, here's what I want to know. What I want you to answer. If we're shutting down much of the world to contain a relatively mild pandemic, which wasn't done for SARS, MERS, or the bird flu, how often are we going to do this in the future? How many people will and are suffering and dying because of these measures, people that would otherwise live or thrive? How many billions are being adversely affected by these measures? If this is our reaction to a mild pandemic, how severe will the reaction be to an intermediate or serious pandemic? Is it really feasible to react this way if a disease is not a serious threat to life? How many people will die as a result of these measures? Where do we draw the line between necessary and unnecessary? When do we say economics and basic human needs triumph the needs of the at-risk population? And when do we say that humanitarian, cultural, and environmental needs take preeminence? How do we strike a proper balance? On top of that, when will countries start taking firm control of wet or live animal markets, unsafe animal husbandry practices, and other factors that increase the transmission of animal diseases to humans? China may seem to be a source of diseases because it is, but it's not the only one. I could give you my theories on this, but I would much rather you think about this. Please, don't let your emotions cloud your judgment. And if you're an expert especially, I'd like to hear your thoughts. Thank you very much.